Hi, I'm Buki Adeyemo, and I'm joined today by Janet Dawson, our Chair. Welcome to our annual review of the year 2024-25, another truly outstanding year for Combined and its people. We're often told by our staff that working at Combined feels like being part of a family. As everyone knows, at their best, families celebrate each other in the good times and support each other in challenging times. That has never been truer than in the year just past. The current challenges facing the NHS are amongst the most severe many of us will have encountered in years of working here. We should be under no illusion about the magnitude of the task. Difficult decisions are needing to be taken. Challenging choices are needing to be made. One choice that we can make is to be as proactive, brave, and radical as we can be in meeting the challenges facing us. We know we can rise to this challenge because we've done it before. We have the right values, the right priorities, and above all else, the right people.
At Combined, we've never been content to sit back or run away from a challenge. If we had done that, we would never have become outstanding or secured recognition as the first mental health trust to win NHS Trust of the Year. We know a call to action when we see one, and we see one now. Over the past year, our people have once again responded magnificently to the challenges before them. By the 31st of March 2025, to give just a few examples, the Trust had delivered its 26th consecutive year of delivering financial balance, the entirety of the current century. Continued a proud record of innovation and growth, with further new services, new facilities, and new teams. Improved care planning in co-production with service users and carers. We had also delivered further historic capital investment in our medium-term future as we continued to eradicate dormitory accommodation and shared bathroom facilities as part of a major capital upgrade at Hartlands Hospital, Project Chrysalis. These are just a few of the very many examples of achievement and innovation which you will be able to find in our new annual report, which we are publishing on our Trust website to coincide with our 2025 AGM.
Our vision remains to be outstanding in all we do and how we do it, including continuing to strengthen integration with our partners and engagement with staff, service users, their families and communities.
Quality lies at the heart of delivering that vision, whether that be achieving high-quality service delivery and outcomes, carrying out high-quality communications and engagement, conducting high-quality research, delivering high-quality innovation, or providing high-quality support and corporate operations. So we are delighted to be publishing our new quality account alongside our annual report. At a time of severe financial challenge, some might be tempted to think that high quality can only be delivered at high cost. In fact, time and time again, we have been able to prove that quality and cost effectiveness can go hand in hand. For example, our achievement in 2024-25 of becoming the first NHS Trust to be awarded silver status by the One NHS Finance Engagement Value Outcome EVO framework was delivered on the back of demonstrating improved quality and reduced cost in our frontline services.
Of course, the bedrock of our success is our commitment to delivering outstanding services that live up to our promise of being safe, personalised, accessible and recovery-focused. In this regard, it was pleasing to see the development of an improved screening process by our autism spectrum disorder team, children, young people and adults, reducing referral response times. A 37% decrease in do not attends delivered through a pilot of an automated text system in community mental health teams. strengthened links between CAMHS, adult community mental health teams, talking therapies and community resources, smoothing the transition for young people leaving CAMHS and accessing adult services. 87% of memory services patients receiving discussion of falls, eyesight, vision, hearing and alcohol consumption. In the past year, all patients had received one or more of these physical health assessments. A new avoidant restrictive food intake disorder training package for primary schools being developed and rolled out. Over 350 patients supported with energy advice through Moorcroft Medical Centre, Bit the Cold partnership with voluntary sector. Early intervention in psychosis being rated top performing, with evidence that service users received a full physical health assessment and any relevant interventions in 98% of cases. All of the examples above show the remarkable ability and determination of our people at Combined to innovate, improve and deliver quality outcomes for people and communities it continues to be our privilege to serve.
During the year, we also launched our new show on our in-house digital channel, CTV, The Quality Show, precisely to give a platform for corporate and frontline clinical teams and services to showcase and highlight the range of quality improvement initiatives being undertaken across Combined. Whether that be improving our approach to supporting carers, strengthening child protection in our communities, or delivering thousands of pounds of direct financial savings through streamlining equipment procurement for resuscitation trolleys. In all these examples, higher quality is being delivered at lower cost and with greater outcomes. You can enjoy learning about these and a whole host of other examples in this year's quality account, and by watching future editions of The Quality Show, which you can access via our website and social media. Supporting and advancing research and innovation are things that were extremely important to us, and we are proud that our annual report and quality account contains details of our continuing success in this regard. Over the course of the year, we said farewell to some long-serving members of our Trust Board, including our Associate Non-Executive Directors, Tony Gadsby and Dr. Keith Tatum. We offer our best wishes and thanks to them for their invaluable contribution over many years to the Trust. We welcomed new members to our non-executive team, Martin Evans and Prem Gabby, Roger Banks and Katie Laverty as Associate Non-Executive Directors, and Nicola Bullen, who joins us through the NHS Aspiring Non-Executive Director Programme.
We also made new permanent appointments to our executive team, including our Chief Strategy Officer, Liz Meller, and towards the end of the year, our new Chief People Officer, Freza Mahmood. We would like to place on record our gratitude to our interim Chief People Officer, Kerry Smith, who fulfilled the role over the course of the year following the death of Paul Draycott. One thing we keep constantly in mind is that strategies, plans and aims are nothing without compassionate people to make them a reality. If there is one major theme that has run throughout everything we have done this year, it has been our unwavering commitment to protecting and promoting the health and well-being of everyone for whom we have responsibility, staff and service users. In this regard, one of the most welcome things we saw this year was the results of the NHS staff survey, which showed us yet again to have maintained our record of being amongst the highest scoring trusts in the NHS, with above average scores across all the NHS People Promise domains and increased staff morale.
We would like to take this opportunity to record our thanks to everyone who has contributed to the success of Combined in this year. We cannot do what we do without our amazing team. It really has been another remarkable year for Combined, We hope you will enjoy this short film, which celebrates the year just past.
The staff survey because it does bring about change.
I think for me it's been the friendliness of Stoke-on-Trent and North Staffordshire, in like the energy in the professionals, the passion.
Well, it was that lovely, and it was how I was treated. I was treated more like a daughter.
Yes, the whole team just did amazing things with me, helping me, talking to me, listening to me. It was brilliant, and yes, it was only 6 weeks, but that 6 weeks made a massive impact on my life.
Be at home with my family and get to just experience that normal feeling of being tired because you've been up with the baby, and it was just really lovely, and I think I can't ever put into words how much that means.
And people are there to help you, that it's not us and them, we're all on the same side, and the professionals are here to help. And then if you want, when you're feeling a bit better, get involved in volunteering. It's great. There's some lovely, brilliant opportunities that combine.
So everyone I came in touch with, even if it's from a receptionist to the psychiatrist, I can only commend how they treated me and made me feel human, and because you do have a lack of faith in yourself during these dark periods, and it was therapeutic.
I wouldn't be alive, and now I love my life. I'm Teddy, and yeah, it wasn't just me, it was my whole family. So yeah, thank you.
We're proud to be an outstanding trust, but we constantly make clear that we are never complacent and that our journey of improvement will always continue to deliver our vision. At the heart of that vision is our commitment to the pursuit of the highest quality possible in everything we do. Put simply, we know that quality really matters, so we are delighted to publish our quality account for 24-25. Quality accounts are produced annually to provide information for the public to demonstrate that the Trust reports on quality and shows improvements in the services we deliver. Quality accounts look back on the previous year, describing what the Trust has done well and where improvement is required. They also look forward, describing areas that have been identified as priorities for improvement, resulting from patient and public consultation. As our Chief Executive and Chair have said in their introduction to this year's AGM, at a time of financial challenge, some might be tempted to think that high quality can only be delivered at high cost. In fact, time and time again, we've been able to show that quality and cost effectiveness can go hand in hand. Our quality account demonstrates how this relentless pursuit of continuous quality improvement burns as brightly as ever at Combined. It gives details of how we listen to our staff, those who deliver our clinical services, and those who play a crucial role in enabling them to do so via our corporate services. That's because we recognise the importance of having strong mechanisms to allow our people to have a voice, raise concerns where necessary, and have a clear voice to shape our ultimate goal of being outstanding in all we do and how we do it. It gives details of some of the initiatives we have developed over the past year to promote and celebrate quality, including the creation of our Time to Shine handbook for frontline teams, our fantastic Reach Awards, our numerous innovation events, and the launch of the Quality Show on CTV. It contains evidence of our core focus on continuous improvement, innovation and transformation across the Trust's 3 strategic priorities of prevention, access and growth, with our Transformation Management Office supporting 47 change initiatives throughout last year, and with co-production, recovery and partnerships at the heart of how we work, ensuring national requirements and local priorities are also taken into account. It sets out our involvement in clinical audit and participation in research, development and innovation. It also provides patient and carer feedback, which has been obtained from within the directorates to bring our service users and carers' voice into this year's quality account. We are determined to ensure that their voice is at the heart of what we do now and in the future. All of this and more is available in the Equality account, and I would invite you to download a copy from our Trust's website. In the meantime, let's have a look at some of the highlights and achievements that you will find there and hear from some of the people who have been involved in delivering them.
Quality is really important because it's about delivering the care to the people that we look after and their wider families, but also it's about making sure that the staff are working to their best possible standards.
The way that we frame QI is all about what matters to you. It's about giving you the tools and the skills and the permission that you need to make the changes that you see need to be made.
It will cost £5,959 to equip all 14 trolleys, and that effectively gives us a saving of £7,642 across 3 years.
That's amazing. That's really good, isn't it? I bet you couldn't believe it when you...
Actually, and I didn't realise how much of a saving it was until I worked out the figures.
We started it in the 2 city CMHTs, pretty much alongside each other. One of the teams chose to have admin in, the other didn't, that's fine. We saw in the first quarter after the change was brought in, we saw a significant improvement in their engagement in that quarter.
So if we look at the statistics here, wow. So we've had 11 staff trained so far, which is great. That's 35%. And we've had carer attendance of 166%. That's amazing. And we have got the referral rate at 100% and completion rate at 100%.
This year we've done so much more in terms of co-production, so that patients, carers, members of our communities are helping us to actually build services and make decisions around what services need to look like and should be looking like, both now and also in the future.
Really excited about today and really pleased to have seen so many people come to help us shape how we move forward at Combined in delivering services. Particularly pleased about the amount of service users and their families and their carers who have come here today, but not just that. We've got our partners at Peel, the local authority here. It's such a rich tapestry of people helping us here to deliver, as always, outstanding care. But more importantly for me, it's not just telling us how good we are. There's been feedback to help us identify where we can do even better.
Ultimately, quality improvement, the heart of it is improving things for the people that we care for. So the people we nurse, the people who support our service users and our wider community. That's what we're here for, and that's why we come to work for Combined, to deliver outstanding care.
24-25 was another successful year for North Staffordshire Combined Healthcare in terms of its financial performance. As an NHS trust, we have a statutory duty to break even each year and not make a financial loss. The trust agreed to a fixed system funding envelope with our integrated care system partners with a plan to break even. We are delighted to report that we overachieved our target and delivered a surplus of £3.5 million. This is the 26th consecutive year the Trust has delivered a financial surplus. Our total operating income for 24-25 was £179.5 million. Our income comes from several sources including integrated care boards, NHS England and local authorities. So day-to-day spending on our operations is classed as revenue expenditure, and in 24-25 our total operating expenditure was £176.8 million. Each year we invest in assets which have an economic life of greater than 1 year, and this is referred to as capital. This would usually include expenditure on new buildings, improving our existing buildings, buying equipment or updating and extending our IT infrastructure. And in 24-25 we spent £5.3 million on capital. The Trust continued to invest in the Heartlands Hospital as part of a long-term project to eradicate dormitories known as Project Christmas, and enhanced our network devices and maintained our properties. As with all NHS trusts, the budget we have is limited, so we need to make sure that every pound is spent wisely. All NHS trusts must deliver efficiencies, and we have systems and processes in place to ensure that any transformation doesn't compromise safety and quality. Our Chief Medical Officer and Chief Nursing Officer make sure savings don't affect safety and quality through an independent quality impact assessment process. In 24-25, we achieved £6.4 million in efficiencies, fully meeting our efficiency targets. However, £781,000 of this was delivered through non-recurrent schemes rather than originally planned recurrent measures. NHS organisations were set an agency target for 24-25 of 3.2% of the Trust's total pay bill. We made significant improvements in our agency usage during the year, reducing our agency costs from 4.44% to 2.49% of our total pay bill. The Trust aims to achieve the Better Payment Practice Code to pay at least 95% of invoices in terms of volume and value in 30 days. During the year, the Trust paid 96% of invoices in terms of volume in 30 days and 98% of invoices in terms of value in 30 days. The Trust's cash position remained constant throughout 24-25, increasing by £1.6 million by the end of the financial year. Our liquidity ratio measures our ability to cover our short-term obligations by using our current assets. A ratio above 1 typically suggests good short-term financial health. Our liquidity ratio at the 31st of March 2025 was 1.5, showing we can cover our short-term obligations using our most liquid assets. Our financial statements are subject to external audit scrutiny to provide an independent and objective view to ensure the accounts are accurate, complete, free from material misstatements, and prepared in accordance with applicable accounting standards. We are proud to report that we received a clean, unqualified audit report from our external auditors for 2024-25. The financial outlook for 25-26 continues to be challenging, with limited growth funding, increasing operational pressures and high efficiency requirements. We are addressing these financial challenges by implementing an ambitious efficiency programme, collaborating with our system partners and focusing on prioritising care for our service users. All trusts have been set targets to reduce agency and bank expenditure based on expenditure levels in 24-25. The trust targets are £1 million reduction for agency expenditure and £0.6 million for bank expenditure. So a huge thanks to all of you who have made 24-25 another great year for combined healthcare, and we look forward to having another successful year in 25-26. We all have a part to play in ensuring the Trust maintains its financial strength, and we should all take credit from this success. Thank you.